to do that, we're going to take our non-dominant hand and we're just going to go to the side of where an injection site is going to be, and we're just going to put a little bit of pressure and we're just going to pull the skin to the side. Then we're going to take our dominant hand with the injection, the needle, and we're going to go in like we're shooting a dart at a 90-degree angle. And you'll want to do this quickly to cause the patient less pain. So we want to steady our syringe. So we're going to
The hypoglossal nerve is the 12th cranial nerve and is purely motor. Its fibers arise from the hypoglossal nucleus located in the medulla. The hypoglossal nerve arises on the ventral aspect of the medulla, between the pyramid and the olive, being related at this level with the vertebral artery, which is located anterior to the nerve. Further on, the hypoglossal nerve exits the cranial cavity by way of hypoglossal canal.
Now, urease is very important in Helicobacter pylori survival. What urease does is that it converts urea and water to carbon dioxide and ammonia. And this is important, and we'll soon see why. But essentially, ammonia, which is NH3, is quite basic, so it's alkaline. And then H. pylori can also secrete some exotoxins, such as VAC-A and CAG-A.
Mid to late ventricular diastole. Now, what is meant by diastole? All right, diastole is defined as relaxation. So, in other words, we could say that this is the mid to late ventricular relaxation. We're in the last parts of ventricular relaxation. So, what's happening here? Well, what's happening here is blood is actually going to be returning to the heart. So, some of the blood is actually going to be coming from the inferior vena cava. Some blood's going to be coming from the superior vena cava. If you remember, there's the coronary sinus. Some blood's going to be coming in there, right?
Another way to say the same rule is that in QRS complex, if you find an upward deflection, it should be labeled R. In the QRS complex, when you find the first positive deflection, it should be labeled as R wave, and any wave before the R is Q, and any wave just after the R is S. Another way to mention these three rules is